On AM 1130, Met 99.9 FM, Prescott, Chino Valley, and Paulden 95.5 FM, Prescott Valley and Cottonwood, the talk of the Quad Cities, KQ&A. It's
Hammer Time.
Waking Up with the YCCA. Hammer Time is brought to you by Lawhorn Plumbing, Arizona Modern Landscapes, JT's Septic, Granite Basin Roofing, Blind Brothers Arizona, Elan Electric, Manzanita Landscaping, Crosby Home Services, RED Plumbing, Eric & Sons, and Yavapai Block. And now from the studios of KQ&A, it's Hammer Time, Waking Up with the YCCA. Here's the Executive Director of the Yavapai County Contractors Association, Sandy Griffiths.
Well, hello, everybody. Here we are again at Hammer Time, one of the greatest shows on earth. And we are here. My name is Tom Riley. I am sitting in for, certainly not replacing, Sandy Griffiths, who is still on secret assignment away from the radio station right now. However, Mike, I have heard that there are sightings around town that people have in grocery stores, restaurants, and what have you, have seen a red-headed person running hither and yon, trying to stay under the radar. Have you heard such things?
Well, speaking of radar, I did hear one about her being in a sleigh with some guy with a white beard. I don't know which ones are true or not.
Oh, you never know who that Sandy's going to be running
That's
around
true.
with. Huh?
I've seen photographs, but they're all blurry.
Yeah, that's right. Dash cams. Nevertheless, we're here at Hammer Time. Go get yourself a cup of coffee. Nice Saturday morning. We're loving the monsoon rains. And our guest with us today is Mr. Stephen Childers. Childers? How about?
Rhymes with builders.
Childers rhymes with builders.
Now, that's an easy one to remember.
And that's T with rhymes with P, and that stands for pool. Trouble, right here in River City. Nevertheless, we are going to talk with Stephen about several different things. And one of those things that we're going to be talking about is going to be his construction company. And then from his construction company, how we are going to how he is transitioning into a whole new business that he is just excited as all get out about being a part of. And before we get started here today, we still have a little break to take, or do we have a little bit of time yet?
Go ahead, take a break.
Okay, we're going to take a break here, and we're going to be back, and we're going to be talking with Mr. Stephen Childers. And again, those of you out there, if you see Sandy, tell her we said hi and we miss her. Right now, Mike, why don't you take us out? You always
Absolutely.
do.
My pleasure, and I echo what Tom said. We definitely miss her, but you know those sightings, some can be true and some not, so we'll just wait and see. In the meantime, you're listening to Hammer Time, brought to you by Yavapai County Contractors Association, and we're airing on Talk of the Quad Cities, KQ&A 1130 AM, 99.9 FM, and in Cottonwood and Prescott Valley, you can find us on 95.5 FM. So as Tom said earlier, fill up that cup of coffee, OJ, or as Sandy likes to hear, that cup of chocolate milk.
Oh, my goodness.
Don't turn that dial. We'll be right back.
You're listening to Hammer Time, Waking Up with the YCCA, a presentation of the Yavapai County Contractors Association. Once again, here's your host, Sandy Griffiths.
And we're back. We hope that you have that glass of chocolate milk with you, or a cup of coffee, or a cup of tea, or whatever it is you partake of in the morning. And nevertheless, we are here with Stephen Childers from two different companies. We're going to start, Stephen. Hello, greetings. Thank you for being here with us. We really appreciate it. Now, you have a company called SMC, Construction Management Services. Why don't you tell us a little bit about that company and how long you've been around and all that kind of good stuff?
You bet. First of all, I do want to mention that I got told when I was younger that I have a face for radio. So I'm still trying to figure out what that means. But anyway, regarding SMC construction, we started in the late 90s in Prescott Valley, Arizona. We have hundreds and hundreds of happy customers around town, commercial and residential. A couple years ago, I made the change to construction management services just to try to do more management and try to phase out of the construction career a little bit. And we are currently managing one of the largest homes in Hacienda that is in the masonry stage right now. And a couple years ago, I actually saw a platform that allowed me to offer health care nationwide. And so last year I became a broker for the fastest growing health plans in the nation.
Wow. I mean, going from construction to healthcare, that's, it's kind of like going from apples to oranges.
Yes,
I mean, it seems to be. So tell us a little bit. Your construction company is immensely successful. And as we talked about a little bit before we got on the air, this huge home that you're building in Hassayampa is going to be one that does you in for the construction industry.
Yes. This should be my coup de grace. We're hoping it should be very exciting. But the opportunities and the troubles that we have found in the insurance space have basically allowed me to find a new career.
Okay, so tell us about that trend. What motivated you to go from construction to healthcare?
Well, first of all, I don't need any more practice with construction. I started when I was 14, and I turned 64 this year. So that's 50 years. So I think I've got that pretty well handled. And there's not much of a retirement plan in that unless you are very frugal and think ahead. And I did not really have anything put together for retirement or for future. The platform that we're looking at now has allowed me to basically create residual income for the rest of my life.
Okay, so when you talk about the platform that you're looking for, not all of our listeners understand what we're talking about when we say platform. A platform is?
Well, it's a business model that allows people to be independent business owners and allows them nationwide to offer essential services that people pay for every month, healthcare being one of them.
One of the things that I find interesting, you said that you're 64, and Mike, you'll probably appreciate this as well. He's not trying to be an influencer. He's trying to get it done. He's still trying to be there and do it and be the guy. That is excellent. We just think that that's wonderful that you're doing that. So basically, from SMC is going to be taking a back seat for a little while after you finish this humongous home in Hassayampa, and then you're going to be focusing on the healthcare. Tell us a little bit about your healthcare. It's Raft Safety?
Raft Solutions is the name of my company that I started that actually is a business name for Impact Health Sharing, which allows me to offer that nationwide. I'm accredited nationwide. So Life Raft is the name that I created to basically people are drowning in healthcare and health insurance.
Let's focus on when people are drowning in healthcare, not necessarily they're drowning in a dearth of healthcare insurance.
And the insurance industry for healthcare is profit driven. It's not really member care driven and motivated. Like the health sharing space has basically presented to us. It started in '81 as the health sharing and 45 years ago as an alternative to health insurance. And lately, in fact, in 2020, a company called Impact was born, and they are the Rolls-Royce of health sharing. They are nonprofit, AI-driven, very, very transparent. Very affordable. They have the best benefits in the nation. So those combined have allowed us to offer something that small businesses, individuals, families, seniors haven't had access to.
Okay, we're going to have to go back here just a little bit before we take a break, and I want to get a little bit of a definition here just to make sure. Health sharing, in my opinion, has always been sneezing on somebody or coughing on somebody. That's not the kind of sharing you're talking about. You're talking about sharing something else, about health insurance. Tell us a little bit about Impact, and what is it that you guys are actually sharing?
We share the responsibility of paying each other's medical bills. So we are a community.
That's huge.
That is huge. And it basically started with the large companies that could afford to self-fund their own insurance. So they did not look for outside companies to provide care for their teams. So they self-funded. So they presented and created AI that drives platforms. So basically with our Impact Health Sharing started with the fact that they want to be superior to health insurance. So health sharing was an alternative, and now it's becoming superior.
Okay, talk now the health. But basically, what you're doing is if I were to join, I would be paying in a certain amount of money, and Mike would be paying in a certain amount of money, and then when it came time for one of us, God forbid, needed health care, and we needed to pay for that, then your company would pay for that, and everybody that's been paying into it pays into a pool, and then that pool is then distributed on an as-needed basis. Now, with that pool, I assume that they invest that money in the pool, and it's not just sitting there in somebody's cookie jar.
So that is a good question. Each member has their own portal. They can see their funds. They can see the transparency. The entire corporation's finances are available to every member. You can see the entire company. It is extremely transparent.
So as far as if Tom or I were a member of that and God forbid, as he said, one of us got sick, more than just the sniffles, does the platform dictate providers?
So it is an open network. There are no network restrictions, which is great. There's open enrollment each month. The portal actually allows you to search for providers in our area. We also have dental and vision, so you can search for your dentist and your eye doctor in our portal also.
Terrific.
So the portal is basically member managed so that you keep track of your own money. So the company would be part of you. You are part of Impact when you become a member. The community takes care of you after you pay your share amount in, which insurance calls a deductible. We call it a primary responsibility amount that you would pay into the community for your bills are eligible for sharing.
We're going to get into that here. We're going to take a break here in a few minutes. But before we do, I have a question. You had said something about how everybody's paying in, and then once you pay your share in, which is the deductible, the equivalent of a deductible, is there a minimum that I have to pay in before you guys are going to help me pay out my insurance?
You get to choose which deductible you want. Yes. Okay, $2,500, $5,000, $7,500, and $10,000 are the deductible amounts.
And those amounts are paid in annually?
That is an annual amount.
Okay, so that's pretty interesting. So I pay in my deductible, and now are there monthly fees on top of my deductible?
There is a premium that is due every month. That is your amount you put into the community for the community to distribute as needed when an eligible bill comes in.
Okay, so now can I meet my deductible in a couple of different ways?
Yes.
Okay, so I can I can go to the doctor and pay my deductible, and the doctor charges me $100. I pay $100, and my deductible instead of $2,500 is now $2,400.
Yes, you turn that receipt or that paperwork into your portal, and then it is deducted. There's also what we have is called a wellness rewards. And this company actually pays you and rewards you for being healthy. So each month you're able to turn in $150 worth of receipts for vitamins and gym memberships and chiropractors and all the things we do to stay healthy. And you get to buy down that deductible up to $1,800 a year. Who does that?
Wow, that is incredible.
That is proof that this company cares about the members and not profit.
That is awesome. That is absolutely awesome. Well, in about 60 seconds, we need to take another break. And before we do that, when we come back, I want to talk about a couple of things just so that you're prepped. AI. I want to talk about how AI affects this. How does I assume it's artificial intelligence. How does that affect this? And what is it that, you're looking at a Luddite here. I'm lucky I can talk into a microphone, And
I can spell AI. That's
okay.
about it.
Okay. Yeah. Well, we're going to get into that. Mike, if you would do us the honors once again and take us out, because you remember all these numbers and letters and things like that, and I can't remember all that stuff.
Well, I'm going to keep you guessing until the next sign up, but I am going to go ahead and take us off to a break. You're listening to Hammer Time. We've got a great show going. Just about everything you want to know about insurance and insurance platforms. So we'll load up on some more questions during the break, and we'll be right back.
You're listening to Hammer Time, waking up with the YCCA, a presentation of the Yavapai County Contractors Association. Once again, here's your host, Sandy Griffiths.
And we are back again, Hammer Time, and that chocolate milk needs refilling. I know that it does. So with that, we're back here and we're talking with Steve Childers from the healthcare company Impact. His company is Raft Solutions, and they are providing a health sharing program. And it's not insurance, but it's a health cost sharing program is essentially what this is.
Correct.
Is that correct?
That is correct. It is not insurance on purpose. We are superb to insurance. And health insurance is on notice. This thing is sweeping the nation. Healthcare needs to be personalized, and it needs to be a community instead of shareholders and profit motive. And that's what makes us different. That's what allows us to provide more benefits. That's what allows us to pay 100% of eligible claims to date have been paid. Insurance last year denied almost 1 billion claims.
Well,
billion.
okay, let's get into that there for a minute.
So that's why we're not insurance.
I was going to save that for the last segment, but I'm going to get into the insurance geekery right now. And basically, with insurance companies right now, we have a variety, and there's some very good doctors in this town who have stopped being normal medical doctors in the normal practice and what have you, and have gone on to doing some specialty things. But the reason that they've stopped doing that is that they were sick and tired of some insurance geek telling them how they should be treating their patients based on statistics as opposed to what the doctor thinks is good for the patients. Please tell me you don't do that.
No, we would never do that. There are, in fact, providers across the nation that now that they have learned Impact are requesting their patients to get on the Impact platform. And these providers are paid within 12 to 14 business days.
So
Think about that.
Well,
It was like, where's this check? Oh my gosh, he just showed up 2 weeks ago. And part of what Impact does annually is they give you your complimentary wellness checkup with $150 worth of labs. And we have a concierge service that calls the provider ahead of time and pays for your appointment before you show up. That's kind of cool.
Well, yeah, I'm sure the provider likes that.
Yeah, the providers are ecstatic about Impact. There is no garbage. We can see anybody in the nation, and Impact will cover it. If you have a specialist that is the top notch in the nation, you can go see them, and Impact will cover it if it's an eligible bill.
Well, Mike, you asked the question earlier about preferred,
PPO.
yeah, PPOs, things like that.
Preferred provider.
And
We have no network, so that doesn't play in.
so basically, I can choose my health care.
You can go anywhere you want.
Just like Obamacare said that I could choose my health care.
Except we don't lie.
He said
Sorry.
that I
Did
did
I say
before.
that
Was
on
that
the-
That
on
was
my
good.
top of
That
my
was
mind?
good.
I'll talk to Barack.
And you
if he
heard
wants
it here, folks. Now, Sandy, of course, will probably get me fired for saying something like that or allowing something like that to be said.
Nobody can find her. I don't
That's
know where
right.
she is. Yeah.
Yeah, nobody knows where she is.
I heard she
That's
was
good
buying a
thing.
hair straightener, but I'm not sure if that's true either.
Oh, my God, no. Nobody recognizes you.
Her
Maybe that's what it
her
is.
hair's like down to her waist when she straightens it.
Maybe that's what it is. Maybe she
Okay,
straightened
guys,
her hair.
come on. Let's give her a little bit of a break.
So, yeah, the benefits of Impact are above board. They're unparalleled in the nation.
So if I'm getting this straight, this is a company that basically, if I join, I can get to pay my deductible either over the course of time of a year, and I can pay my $2,500, $5,000, or $10,000 deductible as I choose during the course of the year, and then you guys take over. Now, there is a monthly premium that I'm also paying and along with the deductible, and that monthly premium varies based on
Age, members of household, which we max out at 3, meaning you don't pay for any more than 3 members. If you have 12 kids, you still pay for just 3 members in the house, which is pretty cool. We have a household deductible, which is pretty
if you have
cool.
12 kids, you need more than health care.
You need something else, yeah. You need to go to the pharmacy for something.
Well put.
Individual plans start at $73 a month. Our family plans start at $378 a month. No extra charge for more than 3. Senior plans start at $96 a month. The senior plans, the supplement plan is top notch because it has everything that Impact offers, except for the health and wellness rewards. They're not going to reward seniors for staying healthy, but for some reason. Anyway, what we have found is that small businesses are really the sweet spot across the nation. Anybody with 49 or under employees, this is saving them, and now they're finding out that they can actually offer health care without having to kick down for it. We offer it to the individuals and give the employer an opportunity to pitch in.
So if I'm reading this information correctly, then a couple in their over 65 can have coverage for both of themselves for $192 a month. I'm assuming that's with a higher deductible?
$1,000.
Wouldn't that, wow.
Limits at $1,000.
Wow.
Your deductible for seniors is maxed.
Pretty interesting. Very interesting.
Yeah, they have health sharing. I believe that Impact learned a lot from the other health sharing companies, and they took a lot of what was good and they added it to their platform, and the things that people didn't like, they did not add it. That's why this is the fastest growing in the nation, is because people are just now catching wind.
Yeah,
They started in 2020, and since January they've grown 25%.
I was going to say there's been some health sharing companies or platforms that have been advertised. Many of them some of them religious based
Correct.
that have been around for quite some time.
It started in churches.
Very curious to see how those are going.
So this platform, instead of focusing on religion or race or creed, has the love thy neighbor approach. That's all there is to it.
Interesting.
we pitch in for each other.
That is awesome. That's just, I mean, it almost sounds too good to be true. Now, the thing is that you're focusing on companies, small businesses, 49 or less employees is one of this kind of your sweet spot, so to speak, as to where this company Impact does its best. Now, if I'm an employer and I have, whatever number of employees, my employees have to pay a certain premium each month, and there's a deductible associated with that. As the employer, I can contribute to my employees' premium, monthly premium. I can pay my employers. So it's up to the employer and the employee as to how that's going to be. Impact doesn't say the employer shall.
Correct.
It just simply says, okay, employer, if you want to participate, here's the bill.
Correct.
Question, Tom. Very good.
And they give the employers a option to run the whole team on one platform, on one policy.
Are there
So it's a group.
Okay, in groups, are there benefits, financial benefits, lower premiums, that sort of thing for groups, and smaller groups, larger groups? Does it make a difference?
I don't believe there is much of a price break. I think if you took it and separated individual plans, the pricing would probably be about the same. It gives the employers a chance to manage it on one portal, all 49 or less of their people. So.
Yeah, I'd like to go back and ask you a question. You mentioned that about an individual can check on their portal to see how much or how many funds are in their portal. Does that just mean that you're able to check and see, am I on target for what my contribution is for this year? Or what all does that portal tell you?
So the portal gives you a complete roadmap of everything that your coverage gives you access to. First of all, it does show you where your monthly premium goes, and it sits in your account, and then it shows you the families that has helped, so it's a whole list of where your money went.
Okay, fair
So
enough.
that's kind of cool. It does show you you're going to have your dental and vision rabbit hole you can go down. You have your prescription pricing. We have the best prescription pricing program in the nation. Most prescription drugs are zero. If it's under 10, Impact will pay for it. The AI geolocates, so if you enter your address on Williamson Valley Road, it will give you the top 10 pharmacies around you that will have your medication, and the first 6 are going to be $0. So you're sitting in your doctor's office and you say, hey, send it to Walgreens or somewhere, because you can see the price right there.
Interesting.
So yes, there's unlimited benefits, and they add new benefits regularly. So
when we
and
get
the
back,
premiums do not raise for 6 years. No prices have ever gone up.
so my premium's locked in for 6 years.
So far, since 2020, they haven't raised premiums once.
Wow. This is I'm going to have to take a look at our healthcare when I get home. Although I'm a senior, so
This is why we're sharing this, because people do not know. It's new enough that people are like, what's that? And so this is an education process. This is enlightening people. And technology disrupts industries constantly. I mean, walk into a Blockbuster. Oh, you can't. Go get a Redbox. Oh, they took over a Blockbuster. Now you can't even get a Redbox. Now you get a stream. Impact is the technology that's taken over, and it will replace health insurance.
So I know we're getting close to another break, but just to verify, if you have, let's say, a hernia, and you go in for your surgery in March, and then come November, you have a broken ankle, there isn't any cap on the number of services you can receive in a year?
No.
Okay.
There is a pre-existing condition clause that we want to mention. So Impact will look back 36 months and will not cover a pre-existing condition in that 36 months. So if you have a hernia 2 years ago, you would wait for a year for that hernia to be covered again or some complication.
So the one frontal lobotomy that I've had, I just need to wait for 3 more years before I can do it
You
again?
had
Oh,
that?
come on now, Mike. All right, this is Tom Riley, and I'm saying we're going to take a break here now. Talk of the Town, Quad Cities Talk of the Town, KQNA, 11:30 a.m., 99.9 FM in Prescott, kqna.com if you want to get us on the web. And also in Prescott Valley and Cottonwood, it's 95.5 FM. Perfect. So there, I did that, Mike. It only took me 3 weeks to get trained in being able to say that. I hope Sandy comes back soon. We're off.
You're listening to Hammer Time, waking up with the YCCA, a presentation of the Yavapai County Contractors Association. Once again, here's your host, Sandy Griffiths.
And we're back. So once again, we hope that you have that cup of coffee. We're talking with Stephen Childers. Used to be of SMC Construction, though he's sort of kind of still a little bit. But moreover, he's with Impact and Life Raft Solutions, which is a healthcare provider not a provider, but a healthcare, not an insurance company, but a healthcare payer.
It's in the sharing space. That is
sharing
correct.
space.
Yes, sir.
And we're learning more about this as we go along here. This is actually a fantastic organization. It's sounding almost too good to be true.
Thank you.
But I'm sure that it is true. I mean, he wouldn't be here lying to us.
No, I got a construction company reputation to protect.
Before we get back into the healthcare, that's a quick question I had. I realize that you're on the twilight of your construction career, but is SMC going to continue to exist?
Oh, absolutely.
Okay, so that company will continue.
I have 2 boys, and I have lots of second generation that'll SMC and Sons or whatever they decide to step up. SMC 2.0.
I just didn't want the public here to think that SMC was going away.
No. We are going to be viable. I will just ease back and do a consultant type of a deal, and the company will thrive.
Super. Thank you for addressing that.
Yes, thank you. Yeah, no problem.
Good question, Mike. I had everybody thinking that this guy was shutting down the doors.
There you go.
No.
Mike,
We have too much momentum.
I'm glad you cleared that up for us.
Lots and lots of happy customers in the Quad Cities.
Although I'm sure that his 2 sons are going to be anxious for this platform to take off, so Dad's not supervising them forever.
And I can babysit the grandkids. Well, yeah.
There you go.
That's what the goal is, to be Papa.
There it is. There's nothing better. Nevertheless, let's go back into talking a little bit more about this health cost sharing program, or platform as you call it. And Impact is the name of the company. And you, through Raft Solutions, are providing access for others to get into Impact's program.
That is correct.
Of healthcare cost sharing.
That is correct.
Now, once again, I want to go through this thing, go through some of the basics. There are 3 basic deductibles. 4 basic. Give us the deductibles.
You have a $2,500, $5,000, $7,500, and $10,000 level for an annual primary responsibility amount, which is a deductible in the insurance world.
Okay, so it's the equivalent of a deductible in the insurance world, though it's not really a deductible. It's out-of-pocket expenses that you pay before Impact kicks in, and it's healthcare sharing.
It is the amount you pitch into the community before your bills are eligible to be shared.
Okay, now what happens with if I pay $10,000 as opposed to $2,500? What is my benefit for that?
You will have a lower monthly premium.
Okay, significant.
And it's harder to hit. That's not a benefit.
Yeah,
the $2,500 is popular because it is affordable for most of the average Americans.
Sure.
They can come up with $2,500 on a flag. Mom, I need money, something like that.
So if I have a small company and I have 30 some odd employees, would my $10,000 deductible blanket for all the employees? No.
They each have their choice to pick their own for their household based on the oldest member of the household, yes.
Okay, and it's up to that individual to decide what their deductible is, and then the employer decides how they are going to contribute to paying the employee's expenses for monthly premiums or even deductibles. That's between the employer and the employee, and Impact basically says, whatever you guys decide, we're here to fill in the gaps.
That is correct.
That's a great question, Tom, because I was going to ask that same thing. If you are an employer and you've got 6 employees, not all of them have to be on the same deductible.
That is correct. Part of the template allows each person to choose their own deductible. And it is a household deductible. Let's not forget it. It's not an individual deductible.
So it's very individual-oriented.
Okay, so if I'm there and I have a wife and 3 kids, basically me and my wife and whichever kid I pick,
up to 26 years old.
The other 2 are taken care of.
Yeah.
Okay, well that's great. That sounds like a wonderful, wonderful opportunity.
We do have up to there is telehealth, which is one of the biggest benefits of this. 24/7 telehealth, which includes mental health therapy up to 3 calls a month.
So if I were to say that Sandy fired me from the program,
and you were mentally distraught,
and I was feeling distraught and depressed, I could call this telehealth thing, and they could either talk me off the ledge or give me the necessary steps that I need to go through in order to be able to find myself again.
Up to 3 times a month.
Or if you've used those 3 times, on the 4th time, you can call me and I can bring you some, shall we say, adult-sized beverage of chocolate milk.
No, you could get on with the telehealth and tell him what they said.
There you go.
So telehealth basically is that, I'm feeling this and I'm feeling that, and I really don't know whether or not I should go to the doctor or I should go to the ER. I can call telehealth, and they'll say, from your symptoms, the person that I'm talking to has medical background, I presume.
Yes. Oh, yeah.
Okay, so that person would be able to is qualified to give me advice
Yes.
and tell me, yes, go see your doctor, or yeah, it's okay, wait till Monday, you'll be fine, or no, get over to the ER as fast as you can.
Yes.
Things like that.
Or that sounds like this. We're going to prescribe this drug, and then you can look up your portal real quick and say, send it to here because I can get it for $0.
And so the telehealth person can prescribe a drug
Of course.
over the phone.
It's a doctor on the phone.
It's a doctor. That is awesome.
Yeah.
That is just absolutely awesome.
24/7. The other good thing to look up is Impact Health Sharing on YouTube. The testimonials are endless. From providers, from individuals, from families, from businesses. It's just pretty much nonstop.
Okay. Another question. Mike, you kind of brought this up a little bit earlier. Caps. So if 1 year, let's say 1 year, I had medical expenses that went up, close to $500,000.
Mm-hmm.
And with those I didn't, but I'm just using that as an example.
Mm-hmm.
Thank God. Yes, Lord, thank you. Nevertheless, is there a cap during the course of a year or a lifetime that I can have my medical expenses being shared?
Yeah, there's an annual cap.
An annual cap.
Yes. First of all, like we mentioned on our break, Impact has reference-based pricing. So when you receive a bill from the provider, you submit it immediately to Impact, and they reprice it with the industry standards. So they will put some common sense to that bill. And then we are responsible for our primary responsibility amount, and only 10% after that, Impact picks up 90%, up to a $5,000 max out of pocket annually for each family. After that, Impact covers 100% of all bills up to $500,000 annually. After they've repriced. So
let me reduce it to simple terms that I can understand. A good friend of mine.
Can we get that simple, Mike?
Yeah, real simple.
I'm qualified.
A plus B. A good friend of mine had to take a helicopter trip from Prescott down to the Valley. Mm-hmm. And it was, let's just say round figures, $95,000. Mm-hmm. So with that individual, and so they get the bill, they turn around and submit that to
Impact
immediately. Impact, when you talked about repricing, so let's say that the industry says that trip should cost from a helicopter $60,000. So then the helicopter company says, I understand what you're saying, but I still expect to be paid $95,000. Where does that go from there?
That is a good question, and I do not know.
Okay.
I don't know that answer, but Impact does have a hotline for members and for people that are looking at Impact that you can ask all those questions. And when you go to impacthealthsharing.com, on the lower right is Ellie, our AI bot, and you could just ask that right there.
Gotcha.
So that is a great question, but I do not know the answer.
Okay.
Good question.
So bottom line is, I was just curious, in the bigger scope, how much gets repriced, so to
Every
speak?
bill gets repriced.
Okay.
Every bill that is...
Well, an insurance company do essentially the same thing.
Blue Cross Blue Shield does the same thing?
They sit there and say, you only thought you were getting $60,000, but we're going to give you $800 instead, and you're going to be happy to get it. And then they send out the ankle breakers, and somebody has to pay for the rest of it.
Yeah, it's very transparent what Impact does for us, and it's something that we all have access to. There's no hidden costs. There's no hidden funds. There's no corporate pool.
So let me throw another sideways question out there after we get back from a break, because we've only got less than half a minute, Tom.
Well, Mike, since you've already started it, you just take us out.
It's my pleasure. Again, you're listening to Hammer Time, having a great conversation with Stephen, and we're going to find out more information when we get back. Again, you're listening to Hammer Time, brought to you by Yavapai County Contractors Association. So we'll be airing on our last segment in just a minute, so don't change that channel, because we'll be right back.
You're listening to Hammer Time, waking up with the YCCA, a presentation of the Yavapai County Contractors Association. Once again, here's your host, Sandy Griffiths.
And we're back, and you have that cup of coffee in front of you, and hopefully you've replenished it, because this is our last segment, and the chocolate milk has got to be running low, but that's okay. One of the things that we want to talk about here, we're talking with Stephen Childers, by the way, who is with Impact. He has the Life Raft Solutions company that carries the Impact Health Cost Sharing platform that people can become a part of. And the more we learn about it here, Mike, I'm just more and more impressed. Mike, you had a question during the break about seniors.
Sure.
And
So
you had mentioned some stuff about seniors earlier. Mike?
I think all three of us sitting here at the table are seniors, but I'm going to ask this anyway.
I can't hear you, Mike. What? Sorry.
So for any senior, let's just pick the age of 65, who happens to be on Medicare and or if they are on Medicaid, what have you, how does that fit into the payment billing process?
So Medicare covers 80%, and Impact will pick up the 20% as what's called a supplemental across the nation.
Just going to say, so Impact X is your supplemental? Okay.
Yep. And it'll cover the prescriptions as long as you have Medicare Part D, as in David. Then we'll
Right.
get the prescriptions. If you don't have D, then Impact won't. You don't have access to the AI prescription pricing, which is really necessary if you're a senior. So.
Well, there are very few things that Medicare will not cover. Some of those things, there are gaps, though, that happen from time to time. How does Impact help fill those gaps?
I believe it fills all of them as long as it fits our eligibility requirements. And impacthealthsharing.com/guidelines will tell you that. The guidelines are very transparent.
So witchcraft, that sort of thing, is not really governed?
No, we're kind of God-oriented, and that's the other side.
Okay, got it. Yeah, no witches. So all that
Oh, they're real. We just, yeah. Let's not be confused.
That is a whole rabbit hole that we're not going to get down.
No.
So basically, we're talking about this program, and if I remember correctly, with this program primarily geared towards small businesses with 49 or less employees, and that is probably the sweet spot for Impact. However, Impact also takes care of the elderly, and Mike, you clarified that it becomes the supplemental policy, healthcare policy for those of us that are on Medicare or Medicaid, and it'll even pay for prescriptions as long as we have Part D. And those of you who don't have Part D, shame on you. At any rate, with this kind of thing that's in there, is there, again, it almost sounds too good. What is the process for getting involved with this? How do I, besides looking at your card here and finding out how to call you, how does a person get involved? How do they become part of Impact?
You will need to seek out and find an independent business owner that is accredited in all 50 states and is allowed to enroll you. And that would be me or anyone on our team. Impact is available on websites. I can give you the website right now.
Go ahead.
I was just going to say liferaft.com. Liferaft.acnibo.com. Liferaft.acnibo.com is our website. My email, liferaft77@gmail, is a really good way to get a hold of me. We can enroll you from there, but before enrollment, we like to educate people and make sure all their questions are answered and make sure that they're very comfortable with the situation and the policy that they're about to sign up for.
So for me to become...
So we have some education, we have some time we spend. We just don't send people into...
Well, I get that. And we'll talk about that in just a second here. If I called Impact and I said I live in Prescott, they'd give me your phone number. And
I don't know. There's some independent business owners in town that are on our team, so they would probably find an independent business owner in our area and give you a phone number. That's why we try to steer people towards the right rabbit hole, which is one of our websites.
Okay, so basically we'd give you a call, and then you sit down with us and you tell me and my family what it is that's good and what's bad and what's different and what you can do and what you can't do and all that kind of good stuff. Answer all of our questions, and then if we want to move forward, we simply tell you we want to move forward, and you tell us how to do that.
Absolutely.
And business owners can do the same thing.
Absolutely.
So
they should.
If you're a member of YCCA, there are a lot of different insurance people out there that YCCA has. But if you're a small business person, whether you are a member of YCCA or not, you should be able to contact Stephen Childers at, and I'm going to give your phone number out here.
You bet.
928-713-3133.
That'll work.
So that's one way that you can contact him, but you really should contact him. And those of you who are just sitting around on a Saturday morning thinking about this and wondering what you're going to do about your health care costs, you could give the same phone call message out there and get a hold of Stephen. Stephen, once again, this is an absolutely fantastic service that's being offered. What haven't we covered?
Well, he's thinking, I'm going to ask a quick question.
Sure.
And you had mentioned earlier about signing up for the membership. Is that membership on an annual basis? Is an individual committed to being a member for a year, or?
No, if you don't pay your premiums, you are not covered.
Okay.
But it is an annual membership that you would renew each year based on your anniversary.
It's kind of like my wife and I on our anniversary. We don't celebrate our anniversary. We decide if we're going to re-up or not.
If you can
and
remember.
We've been re-upping for the last 30 years now.
And open
actually, this is
enrollment
30.
the first of every month. So
Gotcha.
that's great. So that's good news. People usually think they have to wait till the marketplace and the annual enrollment, and we're good on the first each month.
Super.
That is absolutely fantastic. Okay, let's go over again. Website. Website is?
liferaft.acnibo.com.
So that's liferaft.acnibo.com. Okay.
Email.
And your email address?
liferaft77@gmail.com.
Okay. And the telephone number?
928-713-3133.
That is awesome. There's so many different ways of getting a hold of you.
I have to give that number to my mother now, I guess, don't I?
Okay, well, let me ask you another question now. If I wanted to call Stephen Childers at SMC Construction, who would they call? How would they call you?
928-710-0774 has been the SMC number since 94, 32 years or so.
Okay, and your website?
I don't have one for SMC. We haven't needed one.
Okay, you do have an email, though. It's smccmsinaz@gmail.com.
That is correct.
Wow.
Or, Tom, you could drive into Hacienda and look for the biggest structure going on up there.
1855 Woodland Pines Lane.
Yeah, good luck
We've
with
got
that.
240 yards of concrete in the foundation.
Wow.
You contractors figure that out for a while.
So, just out of curiosity, square footage?
6,200 livable on 2 stories and a 900 square foot garage, and a 3,200 square foot crawl space below all that.
Gotcha.
There are probably some people out there thinking, nobody should have a house that big or do that. And, to those of you who think that way, tune into another station. We really don't want to hear it.
To each their own, absolutely.
But Mike, take us out.
Absolutely. It's been our pleasure having a great conversation with Stephen Childers. And again, you're listening to Hammer Time. We'll be right back.
You're listening to Hammer Time, waking up with the YCCA, a presentation of the Yavapai County Contractors Association. Once again, here's your host, Sandy Griffiths.
Well, folks, we're back, and we're just about to say hi and bye. It went so quickly today. It's been a wonderful day. Stephen Childers has been with us. Stephen, I'm going to ask you again. With Life Raft Solutions, the Impact Health Cost Share Company, tell us, how do we get a hold of you? I mean, this is just too good to be true. Go ahead. Telephone number.
No worries. Best phone number would be 928-713-3133.
And give us your email address.
Email address, liferaft77@gmail.com.
And the long website. Say it very slowly.
liferaft.acnibo.com.
That sounds great. Well, the insurance industry and the healthcare cost industry has been changing dramatically, and you guys in Impact, and with Life Raft being the provider, the cover for Impact locally, there are a lot of changes happening. You mentioned during the break that there are a lot of people out there, a family of 5, that is paying upwards of $3,000 a month for insurance costs, and you're quoting them in the $600 range.
Yep.
And I think that that's just fantastic. So, folks, if you're out there and you're going, oh, my goodness, that sounds too good to be true, it is true. So give Steve a call again at 928-713-3133 or liferaft77@gmail.com. Stephen, thank you so much for joining us today. Mike, thank you for helping out.
Absolutely, and I just want to let folks know that even though we're not confirming whether or not those sightings of Sandy are true, rumor has it you can still reach her with any questions at 928-778-0040.
Enjoy the rest of your day.
Hammer time.
Thank you for tuning in to Hammer Time. Waking Up with the YCCA, a presentation of the Yavapai County Contractors Association. Heard each and every Saturday morning at 7, with an encore presentation Sunday mornings at 7 on AM 1130 by 99.9 FM in Prescott, 95.5 FM, Prescott Valley and Cottonwood, and online at kqna.com. A library of past Hammer Time shows can be listened to on the Yavapai County Contractors website at ycca.org.
Break it down.